The Summit Medical Group Foundation serves the communities, especially the underinsured and the uninsured, working to better the health of all of the communities in our surrounding area. We focus in on programs that provide information to patients about their current clinical health, education, and some other supports along the way, such as referrals or other programs such as our current program called Food, Health, and Hope in partnership with the Community Food Bank of New Jersey, along with Montclair State University. And what we're looking to do is intersect with the community and help people understand more about diabetes.
The farmers market was an idea that we talked about a couple years ago because we knew that there were areas in our service territory that did not have access to fresh produce. Currently we have 18 farmers markets like you see here today, and we're scheduled to have 20 for the rest of the year. Summit Medical Group Foundation really gets it. I mean, they pair the health screenings with a healthy food farmers market, so they understand that those combined can have a great impact on their community.
I love doing this. Everybody's very passionate about doing this work, but also the people that we meet at the food pantries. I love meeting the clients that come in. They're kind people who need some extra care that we're able to provide for them.
Today is a real impacting day for the city of Plainfield because it enables the residents of Plainfield to have access to fresh fruits and vegetables and also access to medical care. I want to especially thank the Summit Medical Group and the Community Food Bank for partnering with us to make this day a reality. Without them, we could not have done this. We have the dream and they have the resources. We all came together, collaborated, and made this happen today. And I think this is a great beginning for the city of Plainfield.
I had a wonderful practice, and then I decided to retire. It's just really nice to be able to give to people and serve people that are really needy. I saw one woman with a sugar of 300, and she didn't know she had diabetes. She didn't go to doctors. So we are helping her find health care, and I think that's very important.
First of all, we must understand what we are up against. We are up against a disease that it does not go anywhere. The Summit Medical Foundation come on in and they provide the proper nutrition that we need for the area, for the community, so they can work on bringing the community diabetes down. Because this is a war, and we got to get out here and throw everything we possibly can into this war so we can stop and help people.
I hope the program keeps going, and I'll be here as often as I can.
I'm happy for this program. See a lot of people out here getting what they need.
Thank you for the program. My sugar goes down and I lost a weight too. So.
One of our programs is called Careers in Medicine, and Careers in Medicine focuses on introducing to high school students information about being in the healthcare field.
I'm an orthopedic hand surgeon. I take care of all ages, including small children and infants, all the way to the elderly. I partake in the Careers in Medicine program at Summit Medical Group Foundation because as a student in high school, I did not have a good exposure to healthcare, other than being a patient myself.
The other thing that we do is scholarships for people who are already enrolled in learning about being a healthcare provider in the future. So there's so many things that we can do for our youth. Somebody needs to be around to take care of us as we get older.
We sit here today at 150 Park Avenue, 130,000 square foot ambulatory cancer site, Summit Medical Group, MD Anderson. This was personal for me, and I always wanted to bring cancer care to the forefront of the Summit Medical Group. It was extremely important to me because we have always done, from diagnosis to survivorship, very well, because we had an integrated healthcare model. Now, with our partnership with MD Anderson, we are able to create the goals that we want to achieve where we can help the patient.
I think the pet therapy is a wonderful program, that really serves a purpose in helping people, and I think the dogs really bring that unconditional love that people look for, and I think it's just a very rewarding program for all ages.
We're looking to expand the things that we can do for our own community and the patients within Summit Medical Group. So we started a pet therapy program, and this pet therapy program will be something that will benefit many of the patients.
When pets go into a patient area, the patient's demeanor changes immediately. It's stressful being a patient even on the best of days. And when a pet walks in, the energy in the room changes immediately. People start to smile, they start to speak amongst themselves. Even the staff starts to warm up and relax a little bit.
My husband and I donated from our foundation the seed money to start a music therapy program at the new Summit Medical Oncology Center. We have been running a foundation in memory of our son who died at 26. And he was a wonderful musician and artist, and we needed to give back. We jumped at the chance to bring our program to their new facility because we had 20 plus years of experience and knew exactly what it meant to the patients and caregivers. Brings them comfort, support, and makes them feel just a little bit better.
The gala this year is celebrating all of our amazing accomplishments, and all the fundraising that we receive tonight will go to further expand our programs.
The few of us that are actually foundation employees could not do this alone. We need it with the support of our funders, with people who donate to the foundation, and with the volunteers that are the employees and the physicians from Summit Medical Group. Working with the clients is the greatest satisfaction that I have ever had in a 40-plus year career as a nurse and healthcare provider.